Hey, Jess, you started to talk about just what it looks like for um, treating rural communities and what that looks like as far as rural healthcare in your practice. One thing you had touched on is just like the kind of the pivot to telehealth. Wanted to see if you could just maybe expand on what it looks like to then um, offer your services in rural communities and that implementation of kind of pivoting to a more of a telehealth than modality.
Yeah, well, telehealth really became telehealth when back with the pandemic. And when I first was introduced to it, it was like, oh, it was like a fireworks went off. There were so many avenues that this could be used because so many times I would run into issues where people could not get transportation to, let's say, Seattle, which, just to paint that picture for our the folks in Port Townsend, that would be usually a 50-minute drive around the mountains, crossing over via ferry, and then navigating downtown Seattle to get to the bigger facilities there. And so that ended up being a huge challenge for a lot of folks. They just could not navigate that, and especially during the pandemic. And so being able to bring telehealth services and support to our community was. Oh, do we need to keep going? Okay, sorry. Um, but so being able to bring those services to the patients made a huge difference. And it first started with being able to teach people how to navigate my chart. So I spent some time setting up a program at the facility that would help us teach a lot of these patients how to use their my chart, how to log on to a telehealth appointment. Because we also in Port Townsend, we have one of the highest rates of, or not rates, but the highest age population. So majority of our population is significantly older than other parts of the state. And so what was interesting was to see how being able to access their my chart, access their doctors for telehealth, and just teaching them once or twice was a complete game changer. And so it made me realize that this could be done on a bigger scale with the right support. And there's some, to be quite honest, there are some things that still working out the kinks of the support side of it. Like, if there's paperwork that needs to be done, or, various things like that. But I think a lot of what's happened is moving supportive services more to telehealth has been really well adapted, because it's kind of like calling your friend. You get a phone call. Usually I'll call a little bit in the afternoon or the evenings, because for a lot of our folks, you know they're lonely. They may not have other people, so they really enjoy having those moments where they get to chat and just check in and talk about their day. And obviously I find ways to integrate some of the that care navigation, or needs assessments, or some of the things that I typically do as a social worker. But I also am building relationships, and that is what I have learned is the most important thing. That with telehealth you can still build a relationship with people even though you are thousands of miles away, and it's just about seeing them as a person. And in rural communities, I often would say, when I was in the working like in the clinic directly, I say, we care for the community we live in. And that you could see somebody who would come in and would be very, you know, anxious. They just got the diagnosis. It's maybe their first or second appointment. They haven't figured out the treatment plan yet. So they're in that hurry up and wait phase, which is high anxiety. And one of my favorite things to do would be to come in, sit next to them, and say that phrase of, Listen, we care for the community we live in." And 9 times out of 10, I would get, "I feel that." That's what they would say in response, is, "I feel that." And that was it's such a powerful moment to know that, we could make that connection, and then being able to expand it to other areas. Because it's true, it's that's what rural healthcare is all about, is being able to care for the community that you are in. And even though I'm in a telehealth setting, I still will look up what the weather is. I still will, find out some of the local lore of the area, so I can get and travel to there and get the vibe of what it's like, so I can build rapport with people based on that. "Oh yeah, that's a great place. Oh, have you been to the Spruce Cruise? That's great. They got great burgers over there." And it's just things like that that we have kind of, moved away from in a lot of ways. But telehealth really allows me to kind of be more of that person centered care than I think other forms of telehealth or just healthcare has become in general.
I was going to say, like, you've got to be aware of the turf war in the Pacific Northwest between those werewolves and vampires, right?
Yes, exactly. And actually, Forks is part of one of the communities that we serve. It's one of those that are in that area. It's right around the mountain.
No, I'm so glad that I was able to make a Twilight reference. You know, um, one thing I was going to maybe comment on as well is like that. There's, I think, a new challenge with telehealth is maintaining a professionalism when it feels so personal. I think for me, there's some things that I want to then say, like, hey, make sure that you're treating this like you're seeing your primary care physician, because like you can't be driving or smoking or doing these things that are going to be uh, not conducive to a therapeutic appointment.
Yeah, yeah, exactly. And there's moments where it can be challenging for sure. But at the same time, I also see it as there's sometimes some real benefits to it too. Like, where I've seen it where I've had a patient who became very dysregulated, and their pet will come and sit on their lap, and it's kind of like you get to have pet therapy in a way that they couldn't ever do in a traditional clinic setting or a therapy office. So that's been really cool to see too, is how it it allows people to be a little bit more comfortable. And it's, recognizing that they're inviting you into their home on some level. And they'll always be like, "Oh, don't mind the mess," and I'll take my picture and I'll pan around and I'll be like, "Look at my desk, it's messy too." Like, it's just a great way to be in a space and in their environment and really get a feel for it. But yeah, it can certainly be challenging when you have some difficult behaviors that might come up, or it might feel too casual sometimes. But fortunately, I haven't run into that too much. So
Can you speak to what it was like when patients began returning for care post pandemic? Was there a noticeable influx?
yeah, yeah, there certainly was. And I think really we're still in that space. Truly, I think what we really saw was a significant increase in later diagnosis. And with cancer care, obviously, as you all know, the time is of the essence. And later diagnosed folks tend to have much more complicated treatment regimens and, needing more complex care. And so, what we were really seeing, especially in certain types of cancers, uh, we were really seeing folks who needed, probably to come in maybe a year ago, coming in with some pretty advanced cancers. And when you look at that and apply the rural healthcare lens, it's like looking and seeing this like tsunami coming at you, because we have very limited resources. We have, limited space. We were also struggling at that time with which I think all healthcare systems experienced a lot of health provider burnout. um, you know had lower staffing numbers and all of those things. And I think just now, a lot of organizations are really starting to kind of get a little bit more back on their feet. But it really did. It totally came in, and it was just this huge influx of patients. And for a lot of folks, and a lot of systems, it was a significant stress test that a lot of, especially in the rural community, did not sustain, but not because they didn't want to or were not able to. It was just the systems and the support that they needed was just not there, which is really what's led me to become more of an advocate for healthcare and kind of a rural healthcare, and really trying to raise the alarm bells of like, we need to do better. And we have opportunities, such as the distribution of funding isn't, in terms of like research and grants and things like that, are not really factored in for our rural folks and in the rural community. And so, reaching out to organizations like the American Cancer Society. I have a great partner that I work with, that and who's really was there when I sent an email that was just like, because we experienced a chemo shortage actually. So patients in our community were having to give up treatment. And this was one of those moments where it's like, it just hits you right in the heart, because we'd have patients who were stage 4, and they're like, you know give my treatment to someone else. And that's the reality of what we're living with. And I had sent a letter to the American Cancer Society. I looked up somebody on LinkedIn. I was just determined to be like, we've got to do better.
You were
And
sleuthing.
yes, well, that's where my myriad of background jobs that I've had over the years has helped, is because like I just knew there was ways around this, or ways to at least let people know what was going on. Because a lot of folks in our community were just left with no answers and no support, and that wasn't acceptable to me. And so did what we could to kind of build relationships with some of the bigger cancer centers and things like that. But it was really eye opening of how inequitable it can be when it comes to if you get diagnosed with cancer in a rural community. Um, and I think that's just a product of the system, not a product of the person.